The broadcast is now starting. All attendees are in listen-only mode.
Hello everyone, welcome to today's webinar hosted by the International Society for the Prevention of Child Abuse and Neglect. We are so glad you could be with us today. And today's topic will focus on the Children's Advocacy Center Barnahus model, international expansion of a coordinated multidisciplinary response to child abuse. This is going to be a really important topic for us here at ISPCAN, and I want to start by telling you that we have everyone on mute to avoid background noise. We do welcome you to enter your questions on your dashboard. You will see the place to do that, and then at the end of the presentation, the presenter of choice will answer any questions you have as time permits. We hope to allow about 15 minutes for that. Now, we have not one, but three esteemed guests with us today. They coordinated all of their time zones to be with us and tell you about a unique model in child abuse response. More than 3 decades ago, the Children's Advocacy Center model, and that's CAC here in the U.S., was developed with the aim of ensuring child-friendly multi-agency response to sexual abuse to avoid subjecting the child victim to re-traumatization by repetitive interviews. Chris Newland is now the Executive Director, and we are pleased to welcome Chris today. Now, Barnahus, the European version of the CAC, was first implemented in Iceland in 1998. The growth of Barnahus in Europe has been rapid, gaining new momentum in the last decade. And Bragi Gudbrandsson of the Government Agency for Child Protection in Iceland is here to discuss those efforts in Europe, as is ISPCAN Executive Counselor Peter van der Linden. This is a timely discussion as the topic of interdisciplinary sharing of information and ideas in a global context lies at the very core of our upcoming European Regional Conference theme in The Hague this October. And a little plug here, we would love for you to attend, by the way. More on that and how you can join us after the webinar. So without further ado, gentlemen, I want to again welcome you and thank you so much for taking time out to be a part of the international webinar series with ISPCAN. And Chris, we will start with you. I have turned over your screen and we welcome you.
Thank you very much. It's a pleasure to be able to present this webinar today. I hope that everybody can hear me okay. And Brooke, obviously, if there's an issue, you'll let us, any of us that are presenting today know. So I'm going to be talking about doing the introduction portion of this presentation, and I appreciate everybody who is listening in to learn more about this. So before I talk about actually the Child Advocacy Center and Barnahus model, I do want to put this in context, that child abuse is not, it's oftentimes referred to as child abuse, but it really is a human rights issue. And if you look at the UN Convention on the Rights of the Child, there are a number of articles that reference specifically the issues that we are trying to address within the Child Advocacy Center model. It goes well beyond the voice of the child being heard. It also includes that the best interest of the child should be a primary consideration, that state parties need to be developing programs to help provide support to children and help protect them from child maltreatment. But also that the state parties need to assure that these programs promote physical and psychological recovery and social reintegration of the victim while always looking out for their health, self-respect, and dignity of the child. So across a broad number of articles, the issue of child abuse is very relevant and of particular fit with the Child Advocacy Center and Barnahus model. Now, historically, if we think historically, and I'll speak more maybe from the U.S. perspective, although I think this is common in many areas around the world, is that we're a young field. Responding to child abuse, we've not been around for a long period of time. You think about the origins of IPSCAN and the other organizations and programs to respond to child abuse, we're still relatively young, maybe 50 years old. At least in a lot of contexts of responding in a very proactive way to child maltreatment. The old way, at least when we date back to the early 80s, was that every agency who had some level of involvement with child abuse would be involved, and a lot of times it was focused more on, at least in the U.S., what is it that I need from this child? What is it that I need to obtain for my case, as opposed to necessarily what does this child need? And what ended up happening is that children were often re-traumatized by a system that was intended to protect them. My own experience started off working in child abuse, doing therapy and research, and I distinctly remember a case that was transformative for me of a 13-year-old girl who on 2 occasions her father had come into her bedroom and touched her between her legs in a sexual manner. And this girl came, otherwise the family was a well-functioning family, employed, house that they were buying. The kids were well supported and taken care of in broad context. But these 2 incidents occurred where father came into her bedroom, and I was seeing this girl in therapy, and she looked at me one day and said, if I had it to do all over again, I wish I had not told. And as we talked more about this, she went on to communicate that, what her father did was wrong, and there was a part of her that would never fully forgive him for what he had done. But what the system, all the different agencies involved had put her and her family through was worse than what her father had done. And it was a crystallizing moment for me to recognize that it's not just that a child may be abused, but if we as the system cause them further harm, then we've committed a human rights violation ourselves. So that it is imperative that our initial response, whatever response that is looking out for the best needs of the child. And it was the same philosophy, the same thinking that was introduced by Bud Kramer back in the 1980s in Huntsville, Alabama, where he was the prosecuting attorney. And while many people may think prosecuting attorney is going to be very focused on the prosecution of cases, that actually really wasn't the case with Bud Kramer. Yes, he had a responsibility, but he was very frustrated by the same experience he was having. And all the work done at a Barnahus or a child advocacy center is really built on these 2 principles. That number 1, whatever it is that we're doing, it should actually help children and not further traumatize them. And secondly, the only way we can effectively respond to child abuse is with a multidisciplinary team. It's not just a criminal justice issue. It's not just a child protection issue. It's not just a mental health issue. It's not just a medical issue. It's not just a victim advocacy issue. It's all those. And that everybody can play a role and needs to play a meaningful role in responding to child abuse. So everything about the Child Advocacy Center and Barnahus model is built on these 2 premises, that we have to work as a multidisciplinary team with all the involved agencies collaborating, and that what we're doing as a team should actually help kids and not cause them further trauma. So the new approach, then, instead of children having to go lots of different places and talk to lots of different people, coordinates these activities within one child-friendly environment, where the focus is, instead of what does my agency need, it is what does this child need, what does this family need, and how can my agency and our multidisciplinary team work together in a collaborative way to help support this child. The child should not be further victimized by a system that's intended to protect them. And so what we have seen is the development of this Child Advocacy Center model, and there's 10 components to a Child Advocacy Center, at least in the U.S. First is that we have a child-friendly, child-appropriate facility where they may be seen. This means that it's not an intimidating environment, it's oriented towards them, it's dedicated for this purpose, and that we don't have lots of people coming in and out. That it's a private type of setting where children and families can be seen when there's allegations of abuse, and that we work as part of a multidisciplinary team in collaboration with law enforcement and child protective services and prosecutors and mental health professionals and medical professionals to collaborate our efforts. And at the Child Advocacy Center, we conduct forensic interviews with children conducted by individuals who are specially trained to provide these interviews and to coordinate these efforts in such a way that they're going to allow us to obtain information that is beneficial for the investigation and critical for the investigation. Those interviews oftentimes being observed by law enforcement and child protective services. That we provide victim advocacy and support right there in this child-friendly setting for the family all those that are involved. It's not just a child issue. This is an issue that affects the family. That we provide medical evaluation for children, and not just to obtain evidence, but even more importantly, to be able to reassure the child and the family that their body is okay if there are no injuries, but to make sure they receive appropriate and complete medical care. That also within the Child Advocacy Center, that we provide mental health services to help children heal, and these being evidence-based mental health services to help children heal from experiences they may have had. And that we have a case review system, which is a system for the multidisciplinary team to discuss cases and making sure we're working together in a collaborative fashion, putting the needs of the child first. And that we track our data, that we track the cases we're seeing so we can evaluate the impact of our services and outcomes and be able to maintain consistency over time. And then there has to be an organization. In the U.S., many child advocacy centers are nonprofit organizations or NGOs, whereas in many foreign countries, there are government-based CACs. There are government-based CACs in the U.S. Also. And then lastly, that while providing all of these diverse services in a child-friendly setting, we need to attend to the issues of cultural competency and diversity. Effectively, the Child Advocacy Center Barnahus should be here, must be here, to be able to provide services for any child who may need our services, regardless of how they look, what their age, their age is, necessarily the type of abuse they've experienced, their religious beliefs, if any, the language they speak. We have to be here to serve all of them, and equally effectively, whoever is in our community. All children deserve that opportunity. So this is a picture of the very first Child Advocacy Center in the world, located in downtown Huntsville, Alabama. As you can see, it's a small house, very friendly with an inviting porch, much different than maybe a family would experience if they went to a police station or a hospital or to a Child Protective Services office. It's intended to have more of a comfortable feel for children. And this model that started in Huntsville, Alabama in 1985 now expanded. And here's just a map of the U.S. alone, where you can see there's more than 900 children's advocacy centers in the United States alone that last year saw over 300,000 children regarding sexual abuse, physical abuse, sexual exploitation, witness to violence. And you can see that this model has really spread throughout all of the U.S. So it's a very fair question to ask, does it work? Is this a model that really does help? Is it an effective model? And the U.S. Department of Justice has supported the work done by children's advocacy centers in the U.S. and has supported also the evaluation of these. And I will quickly share with you that every research study that's ever been done has found a positive impact. So we have increased coordination between the various agencies that are involved. We have more team interviews being done. Actually, families report higher rates of satisfaction when being served at a child advocacy center versus being served in some other type of setting. 95% of caregivers agree that CACs provide them the resources that they support their children. And I think the issue of 97% of parents saying, hey, if I know somebody who is addressing this issue, I would recommend them that they participate, go to the Child Advocacy Center. I think that's a very high rating to feel that demonstrates that this is a family-friendly, a victim-friendly approach that renders them getting the services they need, but also hopefully to make sure that the issue of community safety is being addressed. Kids who go to a child advocacy center are found to have much greater access to medical care, and that law enforcement is able to make their charging decisions, whether criminal charges are going to be pursued, in a much more timely fashion, which creates greater efficiency. We also see improved prosecution in cases where there have been actual abuse allegations that are valid. The use of a child advocacy center dramatically increases the rate of prosecution for those that have harmed children. Oftentimes in the U.S., this is the only way to assure those individuals either receive the services they need to help them hopefully not do this again, or to potentially be restricted from access to harm other children. And the last point that I want to make is people say, well, the Child Advocacy Center, it sounds like a great idea maybe, but it sounds very expensive too. And what we have found is by coordinating the multi-agency response, we actually save money. So we have better outcomes in all these variables that I mentioned, but we also save money because it's a much more efficient. We eliminate duplication of activities, and by eliminating that duplication of activities, we save about $1,000 US per case. So imagine that we have better outcomes and a lower cost. So in all of these capacities, it's why there has been the growth of child advocacy centers in the U.S. At this point, I'll turn it over to Bragi, who is going to do the next portion of our presentation.
Hello, everyone. Can you hear me properly?
Yes, we can hear you. Hello,
Can you see
Bragi.
my slides?
Hi.
Yes. It's great to be with you all. Well, I shall talk a little bit about the Barnahus model, which is the European version of the Children's Advocacy Centers, like Chris has mentioned. Now, Barnahus, I should say a little bit about the meaning of the word. It literally means the children's house. It was founded in Iceland in 1998. It's rooted in the principle of the multi-agency, child-friendly approach of the Children's Advocacy Centers. Also, when we set up the Barnahus, we didn't really know anything about the CACs. But when we did, we surely made the best out of it, in the sense that we were good students of and have been faithful students of the CAC model ever since. In Iceland, when we designed our Barnahus, we decided it would be rooted very firmly in the CAC model, with the over aim of integrating the long tradition of investigative approach in child protection of the U.S. together with the legacy of the Nordic welfare model and the principles of the Convention on the Rights of the Child. What is perhaps significant when we talk about Barnahus, and perhaps slightly different from the CAC, is that we did not attempt, we made an attempt to integrate the principle of the best interests of the child on the one hand, and the human rights principle of the fair trial on the other. So we introduced an arrangement for eliciting a recording the child's testimony required to ensure the due process by allowing the representation of the defense as all other relevant agencies. The avoidance of the harmful effect on the child victim by repetitive interviews and having to testify again or being cross-examined in the courthouse during the court procedure if the case is prosecuted. So that's really what the difference is between Barnahus and CAC, that we take these court issues into the Barnahus to save the child from reappearing in court during the main hearing of the case. Now, while the CAC is most often independent or private organization, Barnahus, as it has developed in Iceland and in fact in Scandinavia, is an integral part of the welfare structure of the public, judicial and social welfare system. Now this involves that Barnahus is a public organization in terms of legal standing, financing the services, and the principles of non-discriminatory rights of children to have access to the services offered in Barnahus. Now, allowing for some difficulties definition, Barnahus can now be found in quite a number of countries besides Iceland, in Sweden, Norway, Denmark, and more recently in countries like Lithuania, Estonia, Latvia, Hungary, and Malta. And there are numerous European states that are in the implementing phase. We haven't opened facilities yet, including the UK, Cyprus, and Netherlands. And I'm sure Peter will go through this later. It is recommended by a number of international and professional bodies, including the Council of Europe, and particularly the bodies of the Council of Europe that I will address a little bit later. Now, just to tell you a little bit about the background to Barnahus in Iceland, it was set up following the international awareness, following the Stockholm Congress on commercial sexual exploitation of children in 1996. We did the first research on the prevalence of child sexual abuse, or rather the interventions of child sexual abuse in Iceland, by collecting data from all the different agencies. And the outcome of this came as a surprise to the Icelandic society. We were, in fact, at the time in the stage of denial. The research outcome created a public demand for improved procedures in handling of child sexual abuse cases. And by then, Iceland had recently ratified the Convention on the Rights of the Child and the commitments that it entailed. Particularly Article 3 of the Convention, in the best interest of the child, it is stipulated that in all actions concerning children, whether undertaken by public or private social welfare institutions, courts of law, administrative authorities, and legislative bodies, the best interest of the child shall be a primary consideration. So this was really what it all started from, this commitment, and that's really the essence of Barnahus, or Children's Advocacy Center. And the Barnahus in Iceland is, like I have earlier said, pretty much based on the CAC model. It has the same components in terms of or ingredients, if you like, where the joint investigative interview is at the heart of the activities. But besides, we also have facilities for medical examination. We offer victim therapy, family counseling, consultation advice to the local child protection services, and education, training, and research. As I mentioned earlier, we have slightly different implementation here in Iceland compared to the USA. The heart of the joint investigative interview is really the court testimony. The court judge is in charge of the procedure, as I mentioned earlier, to ensure the due process that needs to ensure that the principle of a fair trial, the equality of arms, and the principle of evidentiary immediacy are respected. And this involves that you include the defense to be present when the child is interviewed. Besides, there are the representatives of the prosecution, the police, the local child protection services. The child is always appointed a legal advocate, even if the child is not a member of or partner to the proceeding. The child has a status of a witness. The legal advocate of the child safeguards the child's legal rights in the procedure.
Bragi,
now, the child's disclosure. Yes.
I'm so sorry to interrupt you. I truly apologize. This is Brooke. Could you please click the orange arrow on your dashboard, because it is covering up part of your slide, and we just want to make sure everyone can see everything here. Do you see the small orange arrow?
Orange, yeah.
Okay, so just click on that.
Yeah,
there
okay.
you go. Perfect. Yeah. Okay, we'll let you get back to it. My apologies.
Yeah, all right. No problem. Sorry about this. This is my first webinar, so I'm bound to do many mistakes. I apologize for this. Now, the same applies in this model as the CSC, but the child's disclosure is elicited by a trained forensic interviewer according to evidence-based interview protocol, and is then videotaped. Now, we have also what we call exploratory interviews. These are not court interviews. We all know that children do oftentimes partial disclosure, and oftentimes the disclosure of children may be a bit ambiguous. And then we offer the Child Protection Services the opportunity to refer children to these exploratory interviews. They're done basically at the request of the Child Protection Services in cases that disclosure is absent or very weak. Or the offender has not been identified, and very often this is also done when the offender is below the age of criminal responsibility. Now, these are conducted in the same manner as the court interviews. They are recorded in the same manner, but there are no people observing or monitoring the interview. So this procedure needs to be repeated if information are brought out that results in charge to the police. Now, we have more than 18 years of experience of Barnahus in Iceland. We have served over 5,000 children during this period, about 250 to 300 annually in recent years, which is quite a lot if you could bear in mind that the total number of children is only about 80,000 in the whole country. Now, the enhanced credibility results in the increase of reports of child sexual abuse. We have seen cases investigated almost tripled during this time. Indictments have multiplied more by 4, and convictions per year have more than tripled. Evaluations that have been done shows the significantly better outcomes for child victims and their families. Now, as I mentioned earlier, Barnahus has been implemented in quite a number, an increasing number of countries in Europe. What is interesting about this is, if you look at, for example, the Nordic countries, where Sweden started the first Barnahus in 2005, Norway 2007, and Denmark in 2013, that the paths of coming into being has been very different among these countries. The role of the state, regional and local authorities may vary. The legislative framework is different. The affiliation of the Barnahuses to social services, police, or the medical sector may differ. Just the position of responsibilities of partners may vary from one country to the next. Even within countries, collaboration varies from being very structured to being informal. There are different targets grouped. In Iceland, for the first 16 years, we were focusing solely on sexual abuse. But now we have followed the Scandinavians in that we are addressing all types of abuse, physical violence, domestic abuse, just as child sexual abuse. There are also differences in terms of the implementation of investigative interview, medical examination, and treatment strategies. However, they all have in common the basic premises of child-friendly and multidisciplinary response to abuse, child abuse. And quite a number of evaluation studies have been done in the Scandinavian countries. All of them show significantly better outcomes for child victims and their families, very positive experiences of the different professions and partners taking part in this. However, they also point that there is scope the fact that there is scope for improvement, and the wonderful thing is that the Barnahus has been very much alive and is continuously striving to improve. Just to conclude, the Barnahus model has been reflected in a number of European international agreements, recommendations and guidelines, in particular of the Council of Europe and the European Union. I won't have the time to go into that, but I will just highlight the Lanzarote Convention, which is a binding convention on the protection of children against sexual exploitation and sexual abuse, which 42 member states of the Council of Europe have now ratified. The basic content of the Lanzarote Convention, the basic message is quite familiar to us who have been working with Barnahus, as it reflects more or less all the principles that lie behind the Barnahus, that the Barnahus is based on: the child-friendliness, the comprehensiveness of services, the emphasis on the interdisciplinary and multi-agency approach, and the proactive nature of it all. That all shows us how much influence the Barnahus model has on international law and thus on the national law of member states of the Council of Europe. Thank you very much. I will give the ball now over to Peter. Can you hear me?
Hi there, Peter, and hopefully you now have control of the webinar, and we do see your screen.
Well, hello there. I'm not seeing what I want to see, but I'm trying to get in there.
I do see a slide that's, I do see your slides right here.
Okay,
Okay,
I'll just stick to that.
Okay.
Well, hello there, Isk and Steph. Hello, Chris and Brachi. Hello, attendees of this webinar. I'm pleased to be able to join you and honored to speak after so well-experienced experts in the field. I will briefly go through some slides with you, and hopefully have enough time for questions, and also towards Chris and Brachi. My name is Peter van der Linden. I'm from the Netherlands. I'm part of the coordinating team of the Promise project. It's a European project, and I'm also in ISPECAN Council on board. And that's something I want to mention because actually the founder of ISPECAN, pediatrician Henry Kemper, was also the first one to establish a multidisciplinary team tackling child abuse and neglect within a hospital setting. And I think it's great that this is a global movement by now, and we are part of it, and the ISPECAN has a lot of expertise on this, so we are in good company with 1,100 members in more than 100 countries. And this slide is about the first Barnahus or Child Advocacy Center provision we had in the Netherlands, which is on one location, and the two women you see is on the right hand is our former queen, and Jeanette van Babel is the head of the center. She is behind the flowers, and our former queen said when at the opening that she was a bit surprised that it took us 25 years to do this opening, because in the Nordics, in Scandinavia, they have been doing that for a long time, and actually all our experts have been trying to establish a Barnahus or Child Advocacy Center for that long, but now we are really there. And well, this is my introduction to the project. On your right hand side you can see all the organizations that are in the steering committee, and I'm involved in the Verwij Jonker Institute with the research of some of the parts of the research. The Promise project is aiming to prevent all forms of violence against children based on human rights, and effectively create and prepare ground for the Child Advocacy Center like and Barnahus-like initiatives in Europe, which are based on child-friendly justice and rapid access to justice and care. The project is aiming staff both at public and private services, at government, justice, child welfare level, and child rights organizations. There are 11 countries who are in the project. They have care provisions which work as pilot to establish Barnahus, to broaden their services, or they started with support of government a new infrastructure in which they established or are establishing Barnahus. The other European countries can all profit from the tools and reports we are creating, and I'll go deeper into that a few slides later. So, the vision of the project is to support this collaboration and enhance capacity and knowledge, and promote an enabling environment for multidisciplinary interagency approach and child-friendly multidisciplinary services based on good practice strategies and standards, and these standards and tools are for dissemination, and we also provided mutual learning. So this is much in line with the previous presentation, so I run a bit through these slides to have more time to go into potential questions. But of course, this is all based on increased awareness on UN, EU, and Council of Europe law and child rights centered and evidence-based advocacy chains between all sectors and governments and parties. One of our first products was a vision document with these four main principles, which are based on participatory rights of the child, on multidisciplinary interagency collaboration, based on the best interest of the child, the accessible and comprehensive services, and high professional standards, resulting in at least these 5 elements with forensic interviewing, with the principles, in line with the principles of due process, making sure the child is not to repeat his or her statement over and over again, medical evaluation and forensic interviewing, psychological support, assessment of protection needs, and follow-up. These are the countries that are involved in the project. It was an astonishing experience to see that it was really spreading throughout the last 2 years, that there were more and more centers and also countries getting involved, which we did not thought would be able, that they would be in a really establishing phase of opening centers already. So we are in the middle of a process of change. I think we can just state that, and these countries which are on this list are doing this, and of course there are countries which are not on this list which are already having centers, like the Netherlands and Croatia, and of course all Nordic countries. And well, within the context of this Promise project, we had a lot of meetings, service exchange meetings and study visits, and that was also very inspiring for all these pioneers in the field that finally had the chance to share findings and tools and experience and get inspired to keep up that work. And we did the first meeting in Croatia, in Zagreb, with Gordana Flanders Center. Second one was in Reykjavik, Iceland, and we did a study visit at the Barnahus over there with Braji Gudbranson, the previous speaker, and we had an interregional conference in Linköping, and the third exchange meeting was in the Netherlands at the center over there. We will have webinars in the end of the year, and last week we had a high-level conference in Belgium, in Parliament with woman on the right is Marta Santos Pais, Special Representative from UN. They were very committed policy makers and stakeholders from all levels, and as I mentioned, there are quite some countries who were opening or about to open centers. This was in Estonia, in Lithuania, in Hungary, in Cyprus. UK started with sex assault centers and broadening their services into Child Advocacy Center or Barnahus or Multidisciplinary Center or multidisciplinary interagency approach as we promote. And as in UK, as in many other countries, it started with tackling sexual abuse, and some centers are having much broader services and some are especially on that aspect. Malta joined with statements from Parliament and law making, and by now we have completed this vision document which I mentioned. We did some mapping, so we have an overview of contact persons and care provisions and what they're doing. We have formulated the 10 golden standards, which are quite comparable with the standards Chris Newlin mentioned for CAC. And so, we had an overview of progress in the countries, which we called the baseline overview. But developments go so fast. We now know there will be a Promise 2 project in which most of the pilot countries will be lighthouse examples for others to keep on promoting this work. And we also have finalized or are finalizing the other reports which are on this slide. One is about enabling factors, preparing ground of what is enabling to do the implementation. We have a law and guidance overview which is quite complete and helps in advocacy and lobbying, but also in understanding which laws in which countries and which UN and European contexts, legal contexts are useful in establishing Barnahus and child advocacy centers. There's also a brief and guidance in doing advocacy work on good and overview of good practices, and a tracking tool which is a sort of ticking the boxes overview which care provisions and governments can use to have a look at where are we in developing provisions like Barnahus, and what are the elements which are still missing or could need improvement or guidance on, and the other tools can assist in that. So on top of this slide you see the website link where you can download most of these products. Some of them are not ready yet but will be finalized within a month. The European Barnahus quality standards are those 10 standards, but they are quite detailed, operationalized, and also supported with a lot of practice and good practice based and evidence-based examples and guidance. The enabling report is the green one, which is more about how to get there and what is enabling the context. The right document is the tracking tool, which any care provision or organization or professional can use to have a quick overview of how you are doing in establishing or in preparing Barnahus-like provisions. Then the red document is this overview of all legal law and measures which are related to multidisciplinary interagency, child-friendly justice, cooperation, and establishing Barnahus-like provisions. And the last, the light blue document, is the advocacy document. So I would like to wrap up and conclude with inviting you all to come to the Netherlands in October, where we will have a European conference where the key theme will be multidisciplinary interagency work, tackling child abuse and neglect. And you are more than welcome to go deeper into our tools. It will all be available, and the three of us, Chris Newlin, Brachi Udratson, and me, will be there to answer any questions that might remain after this presentation. Thank you.
Thank you, Peter. That's such a wonderful introduction to our upcoming conference, which is exactly what the three of you have been talking about, is how agencies and nations even can come together and make such a huge difference in the lives of children and reaching these kids as they start their treatment. So let's head into some of our questions now, and one of the first questions actually comes from one of our colleagues, Heather, and it is a good one. Can one of you translate for us Barnahus and what that means?
I think we all three can.
You want me to address that?
Sure, go ahead, Bragi. You take that one.
Well, I must claim the responsibility for this concept. The concept, the Barnahus, is an Icelandic term, and it literally means the house of the child, or house for the child. And this was originally used in a rather sort of loose meaning, but as our services developed and took on more more structured form, it has sort of developed into have a quite distinct meaning. On the one hand, referring to the same structure as the children's advocacy centers have in terms of the comprehensive interdisciplinary child-friendly approach. But what makes the use of the concept perhaps Barnahus more specific relates to this interviewing in kind of a court setting. So you're really eliciting a statement or testimony of the child for the court hearings in many ways. So that element does differ from Children's Advocacy Center, that the justice system is incorporated in the Barnahus concept.
Very interesting. Chris, I will pose this one to you. Can you speak, we have a couple of questions about funding. Can you speak to funding and how the money end of all of this works? It must take quite a bit.
Well, I think it's different in different areas. As I mentioned during my brief presentation, in many foreign countries, the government, these are government-based programs, and so the government oftentimes will pool money between various ministries or departments that have a role in supporting this effort. In the U.S., we have much more of a non-profit NGO type of approach where there is some government support at all different levels, both federal government, our state governments, our local governments who are supporting our efforts, but there's also philanthropic support for these programs within an individual community. Oftentimes there's people who want to support and donate to a cause that they feel is making a real difference in the lives of children. And so those are two sources, two kind of primary sources. And at least in the United States, there's a Victims of Crime Act fund, which also provides support to this. This is whenever the fines are paid to the government for some type of criminal offense, the federal government, those funds are then given back out to nonprofit organizations that are helping respond and provide services for victims of crime. So actually those who are fined for the crimes they may have committed or they have committed, those monies will actually go back and directly support victim services. So there is a diverse and blended funding stream that is oftentimes utilized to help support the work of children's advocacy centers, and almost unilaterally there is always need for more funding than there is funding available, and so it sometimes can restrict the numbers and quality of services provided.
Well, it's fascinating, and it's obviously led to an expansion. When we saw your map, and all three of you, the expansion has been so impressive. Peter, I will move on to you for a question from Heidi, and she is asking about language barriers. And with so many children crossing borders right now, how do interpreters and language play into this entire model?
Yes, thank you. That's a good question as well. Of course, depends on in which country you are in. But as we know, there are a lot of migrants on the move, refugee children, which need interpreters, translators, and parents who need them too. And in the Netherlands, a lot of the possibilities for translating is not anymore funded by the state. So that is making things more complex. And it's also very important to have some quality standards. And what I know from the child advocacy centers and the Barnahus-like provisions in the Netherlands is that the workers, the social workers, the people who work with the children, I think it's really important that for translation you have the same person, that you don't have for every occasion different translators, so you can build on a relationship, you can do some, that's the term I learned from Heidi, to do briefing and debriefing, so learn about the process, and so that the translator can take his or her role, and the interviewer and the people, the professionals of the center can do their work properly.
Great answer, and obviously it takes a lot. We'll take one more question here, and it will be a lottery, so one of the three of you, whoever wants to answer, speak up first, and that is the best, most effective way to spread this model to more countries.
Is that something for you, Bradji? We can, all three of us.
You can all weigh in if you like.
Well, yeah, if I understood the question correctly, it's on what kind of strategy, advocacy strategy is the most effective in order to share this model among countries. Well, it's a dissemination of information. It's taking part in international collaboration through communication, sharing ideas. That's really the issue. This is a long run. This takes time. It takes years. I've been trying to promote the model in Europe for now almost 20 years. And so this is a continuous work that I think most people that are introduced to the CAC Barnahus model, they become fascinated by it, particularly when they see the model in practice. Chris, you are an experienced advocacy person. What do you say?
I would agree with you, Bragi. I think this is a model that started just as a response in a single community to try to help address an issue that was perceived. And what wasn't even really conceived at that time is that maybe this model could work in lots of other places. This is not a U.S. model. This is not an Icelandic model. This is not a Netherlands model. This is a children's model. And its implementation is intended to be specific to our country. And much like the prior question to Peter, to make sure to address the various cultural issues and language issues. If we can't even speak to the language of the child in their native language, then we're not really being child friendly. So we have a responsibility to do so. The dissemination has been because it's going against long-standing systems that have not always worked together. And this is really turning everything upside down to reorganize how government responds to child abuse, and that there is a government responsibility. That takes time. It takes professionals with direct line experience. It takes a willingness for professionals to engage in a different way. It requires government sometimes to pass laws and provide support for this program. So it's at a multi-sectorial and multi-level approach that does take time, as Bragi said. I applaud the EU and others, the Council of Europe, for their efforts to try to help support the development of this model. And each country will individually need to implement and develop the model that will work in their country given their socio-political structure. So those are, and the other thing that requires for implementation is for people to have training in order to be able to provide quality services. All of this, though, is built on a foundational concept for the frontline professionals. If the frontline professionals are happy with the way things are being handled in their country and feel like it's good for children, then there's not going to be a motivation to change. The one thing that unites, I think, all of us that are implementing this model is that we all have felt a sense of frustration that we weren't doing the best we could or all that we could for children. And it was out of that frustration that we were seeking another solution. And for many of us, I think this Child Advocacy Center model is able to have a much better outcome than the traditional system.
And what an amazing job the three of you have done, and thank you for your hard work. Thank you for sharing your time and thoughts and work with us today, and for giving us really a great primer as we head into our conference in The Hague coming up in October. So thank you all so very much, and we will end it here with just a few final notes. And we do encourage you to join and learn more about ISPCAN. There are so many benefits for you. You can also receive a recording of this webinar. It will be available within 24 hours on our website. Visit there, www.ispcan.org, for more information, and do become a member so we can continue with this type of informational webinar in the future. Certainly we do invite you to join us, as Peter mentioned, to celebrate ISPCAN's 40th anniversary in The Hague this October, and as well in Dubai in November. We have just now started accepting abstracts for the latter conference, and we hope that you can join. And again, www.ispcan.org for more information. Thank you so much, all of you, for your time and your patience and being a part of what these three men had to say today. It's very important for what all of us care most about. We wish you peace and a wonderful day. Thank you.